Good evening, Chicago, and welcome back to Little City TV. I'm your host, Lisa Reyes, and on behalf of the millions of children and adults suffering with autism in our country today, thank you for joining in on our dialogue and helping to raise awareness for autism. Tonight, we have the pleasure of hosting Dr. John McGillen and advanced practice nurse Kim Hogan, who together have created a new era of primary health care for hundreds of individuals with autism and other intellectual and developmental disabilities throughout the Chicago area. Dr. John McGillen will begin our show tonight, and he is a medical director at Northwest Community Hospital in Arlington Heights, who is responsible for case management, quality assurance, and a hospital-wide clinical information system. He is board certified in both internal medicine and infectious disease and has more than 30 years of experience in the healthcare field. Dr. McGillen's leadership as a top physician has been vital to the community, and he has frequently volunteered his medical expertise to treat countless underserved residents of the Northwest suburbs. He plays an important role in providing medical care at Little City Foundation's newly created Center for Health and Wellness. With the recent opening of Little City Center for Health and Wellness, Dr. McGillen, along with Kim Hogan, will oversee the primary health care of hundreds of adolescents and adults with autism and other intellectual and developmental disabilities. So thank you very much for joining us this evening, Dr. McGillen. It's an honor to have you on our show.
Thank you.
Thanks. So you have 30 years of experience in the field of healthcare, quite extensive. Can you tell us how you got involved with serving this population and your own story, what drew you?
Well, I kind of have a personal interest in the residents of Little City because I had a brother who had a severe handicap. He had cerebral palsy. He didn't have autism, but he had severe cerebral palsy and really was wheelchair bound, suffered from a lot of mental disability. He used to come to Little City.
I did not know that.
Yeah, he came to Little City and he used to come there just during the day. They had a little program for people who would come just during the day and then they'd go home in the late afternoon. And so I always had a attachment to Little City. And then when Northwest Community Hospital began affiliating with Little City, it was a perfect fix for me. And so that was ideal for me.
That's great.
Are you going to tell us about your story?
About how I joined Little City?
Yeah.
Okay. Well, actually, it was a desire to do good with the skills and talents and abilities that I had, and really, when the opportunity presented itself to me, and along with other opportunities, I thought to myself, there couldn't be any greater PR to do in the world than for the wonderful people that we serve at Little City. So
more meaning.
It's very, very meaningful. Everyone's invited to come on campus and take a visit.
That's really the key. Your ego dissolves when you walk onto Little City, and you really become attached to the people that are there. Yeah.
They're beautiful people.
Indeed.
If Dr. McGillen, if there are young people or young, I guess, future medical professionals, future doctors out there watching tonight, what advice do you have for them in terms of when it comes to treating people with autism or other disabilities?
Well, the first thing to do, Lisa, is you have to remember that the goals of treatment, the goals of taking care of anybody are the same. They are to preserve life and to reduce suffering. And those are identical in autistic people, handicapped people, anybody. They're identically the same. Now, so the goal is the same. The only thing that's a little bit different is you have to work with a little bit of different set of abilities of the patient to provide history and even exam. For example, you might not be able to take much of a history on a certain illness. You might have to talk to other people who live with the patient to provide you some history. And in addition, you might not be able to examine the patient as you would someone without a disability. So for example, you may have to examine the patient as they walk around the room. You might have to examine their belly as they walk. Now that's a lot different than having somebody lay on an examining table. But you work with what you're given. That's always the rule. You work with what you're given, and in that context, the treatment becomes a little more challenging sometimes, but really basically the same, because it's like we talked at the beginning, the same goal.
That's excellent advice. For parents who have adolescents with autism or young adults or adults with autism, do you have any advice to give them in regards when it comes to dealing with their health?
Well, I think the rules have to be the same as with anybody. They have the same responsibility for their vaccines, for their nutrition, for their exercise as anybody does. And sometimes people with disabilities, we tend to forget one little area or another area. We don't work as much on their nutrition, or we don't work as much on their exercise or some other area.
Because you may think that it's harder,
That's
they
right.
won't understand.
It's more difficult,
Right.
it's harder to motivate them maybe,
Right.
but it's really important that be done, that they be treated and that they emphasize everything that everybody else has done.
And that parents just take the patience to
Absolutely,
teach them.
absolutely.
It looks like we have our first caller for Dr. McGillen. Caller, go ahead, you're on the air.
Yes, good evening. Dr. McGillen, my question, do you have any theories on the dramatic rise of autism? And in your experience, have you ever seen such an epidemic?
There's no question that autism is rising in its incidence. There's a number of factors that can be involved. One is the greater diagnostic testing and diagnostic acuity of physicians and pediatricians currently. How much autism we've had in the past isn't really clear to me. Mild cases of autism, I'm sure, went undiagnosed for a long time. So there's some question in my mind how much this epidemic is really increasing. But there's no question that it is increasing. I can't tell you exactly why that is. I can tell you a couple reasons why it isn't. I have looked at the data on the vaccine issue, and it really isn't supported by the medical data. It just isn't supported. But something is causing this, and I think that supporting basic research in this area is going to be absolutely critical. In infectious diseases, we have seen epidemics like this occur before, but nothing in the area like autism in the past. So I haven't seen anything quite like this, and I wish I had a reason I could tell you why it's increasing, but I can't.
It's a great question.
It is a great question. And it's a scary question,
It
too.
is very scary.
A scary question for parents. Very frightening.
So really, and that's a good reason. Our diagnostic tools have gotten better, so we can diagnose people that have autism, whereas before they may have slipped under the radar or slipped under and not been able to receive any treatment. So that's a good thing, is that would, even though it seems like the rates for autism are increasing, really we're just identifying children that have autism at a younger age so that we can start treatment earlier.
That's a huge
Right.
issue. A huge issue. And we're so much better off now than we were before. Can you imagine what it was like before when these kids were kind of
when parents didn't know, when they weren't educated.
That's right.
Right.
That's right.
And, if I may, this is a good segue for parents who, parents should very well be informed and educated about developmental milestones so that they can monitor their children and make sure that they're reaching certain milestones, because it could be a sign for autism, and we have those charts and everything on littlecity.org/autism.
Absolutely.
So, Dr. McGillen, we love success stories on our show. We love sharing success stories and really trying to be positive and not be negative, and talk and give parents who may have children or adolescents or adults with autism some hope. Can you share a recent success story that comes to mind?
Oh, boy.
Is there one about the healthcare or Center for Health and Wellness, something you were able to do?
Well, I tell you, I think what we're doing is really Kim Hogan, who you're going to interview next, is really the person who's spearheading that. And if she's going to give you, if you're going to ask for success stories at Little City, she's the one who's going to give you the primary. Let me give you one success story, one little success story, and that's that we have set up the clinic.
Yeah.
That's a big success story. This thing has been talked about for a long, long time, and has been painfully moving very slowly. But now it's open, now it's working, and I'm sure Kim can give you a long list of success stories that she's had over at Little City.
Okay, it looks like before we introduce Kim, we have one more caller for Dr. McGillen. Caller, go ahead, you're on the air.
Hi, Lisa. Hi, Dr. McGillen.
Hi.
My question is, how did your hospital get involved with Little City, and how does that partnership work?
Just kind of talking about that. That's excellent.
Yeah. Little City is is proximate to our hospital. It's not far away at all. It's in Palatine. Our hospital is in Arlington Heights, and we have an entire branch of the administration that's involved in outreach to our community. Northwest Community Hospital is not going to change the name community because that's a hallmark of its character. And one of the things that in community that we do is we reach out to the community, to the various parts of our community, whether it be a poor section of the community or an area of the community that's handicapped. And in our locale, we have two organizations that deal with handicapped and autistic people. One is Clearbrook, and we've had relationships and work with them. And we also have had this relationship with Little City. And this relationship has developed over the course of years, primarily through the work of the CEO, both from Little City and Northwest Community Hospital. And how this relationship was going to work, how we were going to take care of and provide medical care for the people of Little City has been a long, long discussion. And it basically came out of our commitment to reaching out to different segments of the community for community care, community outreach, I guess is the term they use. So it's their proximity to the hospital that really engendered it, in that they're being part of our community, as are other areas of the community also. Yeah.
Just to clarify, Little City's Palatine campus is about 56 acres, but we also have homes throughout Chicago and offices in Chicago. So, but the Center for Health and Wellness, correct me if I'm wrong, Dr. McGillen, will eventually, the goal is to open it up to all individuals with disabilities throughout the community, not just those that belong to Little City.
Absolutely.
So,
absolutely.
serving the entire community of Chicago.
Yes.
So thank you so much, Dr. McGillen.
Thank you, Lisa.
In just a moment, ladies and gentlemen, we'll have Kim Hogan with us. Ms. Kim Hogan is an advanced practice nurse on staff at Northwest Community Hospital who provides early care and medical assessments for hundreds of adolescents and adults at Little City's Palatine campus. She has more than 25 years of nursing experience and had regularly volunteered at Little City before being hired in January to provide dedicated healthcare services. Kim completed her master's degree from the University of Illinois at Chicago and obtained certification as a family nurse practitioner in 2009. Since Ms. Hogan took her position at Little City in January, Little City emergency room visits have dropped significantly. Kim, thank you so much for joining us this evening.
Thank you, Lisa. It's a
if I
pleasure
may
to be
call
here.
you Kim.
Of course, absolutely.
Kim, can you tell us in your own words a little bit about, I say that you're in the fields and in the trenches because every day you work in the Center for Health and Wellness and at Little City.
Yep.
Can you tell us in your own words a little bit about the center and what makes it unique?
The Center for Health and Wellness, I think, as an advanced practice nurse and a nurse practitioner, it's a unique facility. I'm not aware of anything like this on the campus of any developmental disability facility in Illinois or in Chicago. We are on the campus of Little City, as Lisa has said. We are there all day, Monday through Friday. And we are present to care for the physical and primary care needs for our individuals. And because we're there every day and see them every day, it's almost as if they become part of our extended family. So we get to know them in a way that most healthcare providers have not the opportunity to. And that helps us care for them much better. And as a nurse practitioner, as a nurse, it's a wonderful opportunity for me.
That's wonderful. That's wonderful. How did you get involved with working with patients with autism? Like, what drew you to this kind of position?
Well, it's interesting, Lisa, because as you mentioned when you were introducing me, I have been a nurse for many, many years. And nurse practitioners are registered nurses that complete a graduate program. To become a nurse practitioner, I am able to diagnose and treat and manage many of the common primary care ailments that you would go see your family practice doctor for. And what I've always enjoyed is working with underserved populations. That is where, throughout my nursing career and as a student, that is where I got the most satisfaction. When I went back to school and finished my graduate degree, I was looking for opportunities to practice. I had wanted to work with a population that was medically underserved, that had been overlooked. And at the time I finished school, I became aware of this opportunity at Little City, and it was an opportunity to work with a population that has not been well served in many ways by the medical community. And so I had, to be honest with you, I had not thought about working with people with autism or developmental disabilities, but it is a perfect opportunity for me to do what I enjoy best. And
Because there's such a strong need.
there is a great deal of need. It's a population, Lisa, that is not, as I said, is not well served in many
And
ways.
why do you think that's so? If there are future professionals who are looking into nursing, we want them to obviously, serve this population.
Well, part of it is that, as John said, there are difficulties in caring for people with autism and intellectual disabilities, developmental disabilities. Difficult to examine them. It is difficult to communicate with them. So it is in a typical office environment. It is in an emergency room, in a treatment center. When you're rushed, you have a full schedule of people. It is hard to be able to devote the time and the effort and the extra, not so much the extra care, but the extra attention that's needed to give proper care to our folks who have, frankly, a lot of difficulty being able to convey what's wrong with them. Many are nonverbal, many aren't able to tell you, in words anyway. And that is what is so fortunate about the opportunity that I have at Little City, is that I know my people, and I don't need words sometimes for them to tell me what's wrong with them. And that's an advantage that I have that other healthcare providers don't. So
And it's fulfilling to serve this population.
it's
That's
very
so
fulfilling. Yes, it is. I enjoy it very much.
That's great. That's great. Let's see. Do you have as mentioned, we love success stories on this show, and you've been working every day at Little City with hundreds of individuals. Can you share with our audience a recent success story?
Well, I think any participant that I'm able to see and treat for an urgent care sort of illness that I'm able to keep from having to make an expensive and traumatic visit to a treatment center or an emergency room, I think that's a success. So I have a success story probably every day. Just today, I was walking through our sheltered workshop area. Most of our participants, our adult participants, come to campus. They work. There's a sheltered workshop. There's various activities for them. Even if they happen to live in a home in the community, they come to the Little City campus in Palatine, and they spend most of their day there. So I've gotten to know everyone very well. And I just happened to see an older gentleman, his name is Steve, that I have seen almost every day. And because he knows me, he said, "I don't feel good." But he couldn't really tell me why. So I brought him, I had one of the staff members bring him up to the Center of Health and Wellness, and I was able to take the time and examine him thoroughly, and I believe he has probably a very, very bad sore throat. But he's not one to complain. So this is, I was able to diagnose it, and I sent a throat culture. We'll start him on some antibiotics. This is something that might not have been picked up otherwise, because he tends to not complain about things, but he was really pretty ill. So that's a typical success story
So you
for
were
me.
able to treat something that was very common and simple
Correct.
enough to treat before it just got out of hand, and there were worse
Exactly.
problems that could have occurred from it. So-
Right. And he's not able to communicate very well when he's not feeling well. But I could, because I know him, I can tell by looking at him that he wasn't feeling right. And that's the advantage of being on campus every day.
That's wonderful. We're so happy to have you. Can you tell us, I heard that the Center for Health and Wellness will also do a lot of preventative education and treatment. Can you share a little bit about that? So it's in addition to the primary health care, what
is
else
correct.
will be served?
That's very correct. The primary care and the urgent care is only part of the story. We treat the entire individual there. As John alluded, there's a great need in this population for health and wellness programs. People with developmental disabilities, if you look at almost any health indicator, they suffer from obesity, hypertension, diabetes at a greater rate than the rest of the population. And these people can benefit from exercise programs, dietary teaching.
And so that'll all be included.
This is all part of
That's
the
wonderful.
services that we'll be providing
That's
for our
wonderful.
people.
That's wonderful. Looks like we have a caller for you, Ms. Hogan. Caller, go ahead. You're on the air.
Hi, good evening. This call is for Kim Hogan.
Yes.
See,
ma'am.
I work at Northwest Community Hospital ICU, and I've been there for 18 years, and I couldn't remember taking care of a patient with diagnosed with autism. So I was just wondering if we don't get that many patients, or that they're misdiagnosed and they're diagnosed with something else.
Well, you work in the intensive care unit, correct?
Yes.
You may well have taken care of individuals with autism. Sometimes if they're very critically ill, their autism isn't as much of an issue. Perhaps you were not aware of it. As John said, many people, this is a broad spectrum illness, and there are many people with autism that are fairly highly functioning, as we would think of that. And their autism per se is not as big a factor in their treatment. But I can guarantee you've probably cared for many people with autism, perhaps without even realizing it.
So do you have any tips or advice for nurses who may not know that they're treating someone with autism, or maybe they do know, and maybe to help with their care for people?
I certainly do. The first thing is to not be afraid to take care of someone with autism. They can exhibit some strange behaviors, perhaps, to those of us, that aren't used to being around folks like that. It takes time, it takes patience, but they will respond to caring and just the knowledge that you're there to help them. Don't be afraid of them, and try to take a little extra time and talk to the people that that accompany them to the hospital and find out the best approach. But they respond to caring just the same as anyone else, and I would encourage nurses to focus on that first.
That's great advice. And also, as a communications professional, so much of communications is nonverbal. It's through your emotions, your facial expressions, your body language.
Absolutely correct. And that means more than words.
Right.
Yeah.
Right. That's excellent, Kim. Thank you. Thank you.
You're welcome.
Ladies and gentlemen, before we end our program, allow me to make an incredible announcement. I'm very, very pleased to make this announcement. Little City has, in its 50-year history, embarked on the most aggressive advertising awareness acquisition campaign in celebration of its golden anniversary year. And tonight we'd like to get you more involved and learn a little bit more, and visit our Facebook page to learn more. We're calling it Find Little City in the Windy City, meaning search for our ad placements on billboards, newspapers, the Metro, and the CTA in the coming weeks, and even our commercials on NBC5 Chicago this week, and take photos of them. Post them on our Facebook page, and the person to post the most photos wins a worthwhile prize. So have some fun and generate some awareness for autism. As always, if you could not get your question in tonight for Dr. McGillen or Ms. Hogan, visit our website at www.littlecity.org/autism, and visit the Little City TV section where you can submit your questions and watch other previous Little City TV segments. Or you can just email us directly at littlecity.tv or littlecity.org. Thank you so much for joining us this evening, Ms. Hogan and Dr. McGillen. We're delighted to have you, and we look forward to seeing you again next week for another fascinating segment of Little City TV. Thank you, Chicago, and have a good evening.